Our first health center was the San Fernando Health Center, and it opened in 1973, 40 years ago. It was built to serve 10,000 residents of the Northeast San Fernando Valley. And today we serve 65,000 to 70,000 unique individuals who will make 250,000 visits to our health centers.
Northeast Valley has grown over our 40 years to 14 sites now, serving patients in the Santa Clarita and San Fernando valleys. We offer primary care services and some specialty services serving children, adults, women's health services providing prenatal care, GYN services and treatment of STDs and family planning. And we have several special populations clinics serving the homeless population, the HIV and AIDS population, and several school-based clinics at a middle school, a high school, and a junior college.
The fact that we continue to be one of the largest community health centers and provide a huge breadth and depth of primary care services, as well as WIC program, dental services, women's health services, pediatric services, and others, is something we're very proud of.
When I came in for my prenatal checkup, I took a glucose test, and it turned out that I was diabetic, and I had no idea. So that was really difficult for me to try to cope with that and figure out what I can do, and I just felt like really alone and like I was gonna die the next day, you know? So I got hooked up with a really good doctor, Dr. Advani, and she gave me a lot of resources to look over. She recommended some books for me to read and to make lifestyle changes.
If it wasn't for this clinic, I'd probably be dead. I wouldn't even be here. 2006, I happened to be in the 7-Eleven parking lot a couple blocks up the street from here when somebody decided they were going to do a double homicide right in front of me. And about 2 weeks after that, the people that did the homicide came after me and tried to kill me, pounding my head with a rock. I started having like some really severe seizure activity, and it got to where I was having seizures up to like 50 times a day. And this clinic really worked with me and various other hospitals and doctors and everything to get me back functioning.
Staff went above and beyond in helping me be able to get insurance for myself. There was a time when it got terminated, and that same day I had an appointment. So when I went in, the staff were able to help me fill out the paperwork to get insurance. And after that, I was able to attend my appointment that same day.
Hace 2 años, mi niño pequeño tenía un dolor. Yo puedo hacerle estudios aquí, pero creo que lo que tiene el niño es una apendicitis. Directamente al hospital. Entonces ellos hicieron todo rápido para mandarlo al hospital, y mi hijo pequeño vive porque en la clínica actuaron rápido.
Right around elementary school, I didn't have health insurance anymore, and neither did my mother and father and brothers and sisters. So we actually came to NEVHC for our healthcare services. When you attend to people's health needs, what happens is they have a higher likelihood of doing better in school. If they do better in school, they have a higher likelihood of going off to college. And if you go to college, you're likely to make $1 million more throughout your adult lifetime than you would if you had not gone. An investment in children, an investment in people's health in this country will definitely pay dividends, not only for a family and an individual, but for the entire economy and for society.
Northeast Valley is in a growth spurt thanks to the Affordable Care Act and our donors and collaborative relationships and joint ventures. We have a new Center for Adult Wellness that'll be opening on the campus of San Fernando in 2015. We also have, thanks to the vision of Supervisor Zev Yaroslavsky and the joint venture with LAUSD and the Department of Health Services, a new teen health center opening at San Fernando High School, and that will open in 2014. Farther down the road, we're looking forward to becoming recognized as a patient-centered medical home and really meeting all of the opportunities of health reform.
I just want to thank all the staff and my fellow board members for working so hard to make Northeast Valley what it is today.
Entonces solo quiero decir gracias y ojalá que estas clínicas y estos lugares sigan abiertos y disponibles para ayudarnos.
I'm really grateful for this organization, for the work that they're doing in our community.
I think the thing that's most important to me is to just say thank you. Just say thank you.